The radiology field is hurting workers. Health Problem Radiology by Samantha Woodson from Johnson Community College. The overview of the problem is that radiologists are around radiation all the time because that's what they work with. And whenever they're exposed to it, it can cause cancer, skin disease, and hurt organs in the body. And since radiologists are always in the room whenever it comes to surgeries or just using the radiation machines, they're the most ones to be harmful by the radiation. And there are low side effects to even feeling it, like just sickness, headaches, vomiting, a fever, and causing damage to the organs. It can be in different ones, but extreme radiation over time can cause cancer, which radiologists are around radiation their whole career, which can cause very harmful things to their body from it. And in the picture, it shows us how, in some cases, they have to be in the room whenever there's a picture taken instead of just shutting the door and going outside. These are pictures of radiation on the skin. The first one, the girl has it looks like a rash under the armpit. That one looks mild. The one in the middle is the harmful one. It looks like there's skin disease there. It's close to the foot and ankle, and it looks blistery. And the hand, it's low, but you can still see where the radiation is on the hand. And it can still cause skin disease and make you sick and vomit, headaches. There are lists of solutions that have already been tried. The first one, there's been these little lead pieces, and what has happened with the lead pieces is that they were made to bounce the radiation away from the radiologist. And the picture that you see is with the clips on it to bounce. But what we can get away from it is that the clips can fall off to the ground, or because it's radiating back, it can radiate back to a patient that isn't fully covered, and it can make them get more radiation than they should. The second one is the biggest one. There's already a radiation apron already available for all radiologists to use. But what is happening is that it's not covering the full body. Their feet are left, some of their legs are left, their arms are not covered, their face isn't covered, their whole back sometimes is left open. So it's good right now, but in the future something needs to be done about this, and a large amount of radiation over the career, as we talked about, can be very deadly. That even though they have these aprons on, there are still records they have to keep of how much radiation they get in their life. And as we see, the picture that just moved is an example of a graph of how much radiation a person or the radiologist can get from wearing just a skirt and the vest or the apron or no cover at all. And even though it's still less with the apron on and with everything being fully covered that they have now, there's still radiation that is still being exposed to the person. So my proposition is that there should be a full body lead apron that is covered from head to feet. The full body would make it easier for a person to move around in, and it would cover everything, and nobody would be exposed to the radiation whenever they're working. And it would take away from how much radiation they would get because they wouldn't get none. The picture on the top of the woman is what is used now. And the picture on the bottom of the man is the idea of covering the whole body and it be completely radiation free. The components of the proposition is you would have to research a topic like I've kind of done, and you would have to use more about what the lead apron is made out of, how did they come up, how can we make it a lighter version and make it full body. Then you would need data of the invention, of how would you want it to look and be made out of. Next, the statistics of the money cost. Where would you take the invention to get done? The data on it, how will it work? And lastly, you would need to get people involved in wanting to do it and make it work, like hospitals, organizations. You would need to test the experiment and see how well it even does. The problem is a good solution because the lead apron that we have now doesn't work that great. And with it being a full body one, there would be no radiation at all left for the radiologists to get. So the solution would make radiologists have a low to none exposure to radiation than what they do and consider it now to be. The discussion of how it can get accomplished is because the product of the lightweight full body lead apron will cost money and resources. The product idea and research can be given to a college university like Duke in Carolina because they're high health organizations and hospitals and them universities that will help create better future products for the health industry. And whenever you get them involved, they would want to have their name put on the organization, or at the bottom where it says woman, it's a woman development, and what they do is, they help women out. But you can get any universities or organizations to be likely to put their name on the product, and with that they would pay for the cost, they would pay for how it to get done, for the data to be showed. They would basically have their name and their reputation on the lightweight full body radiation apron. And this is a good way for it to work and be used and tested because they work with health problems every day, and they would be the ones that would most likely help you start it and get a good cost on it and allow you their resources that they have. Next is the call to action. You as the audience needs to get the information out there. You need to tell how much radiation harms radiologists when they work. If it's just people that you know, people that you might see in hospitals, radiologists themselves might not even really know about this. You can tell anyone, and you can say how the lead aprons that are being used are not good, that they need a full body one to make sure that all the radiation is not gonna travel them throughout life and cause cancer and skin disease. And you can also get information yourself. You can talk to hospitals and universities. You can have meetings with them and just really try to get it out there to solve the problem. And these are all the references that I have used in coming up with the information and the pictures.